So Jack, how are you feeling the conference is going? We're into the first day. You must be pleased?
I'm very pleased. I'm thrilled how it's going. The kind of discussions that I'm hearing, both certainly in the plenaries and between plenaries and just chatting to folks, has been very stimulating. People are really keen to kind of engage on the questions about how do we, have high-performing community health centers. Like, I'm really, really pleased.
Now, one of the things I find curious is, and this was true last year, that there is such a need for community health centers, and it seems like the community health centers, at least anecdotally, have been able to make the case for themselves. But we heard today that there's a very low percentage of people who are actually benefiting from community health centers. So why the disconnect?
Well, I think we've got to tell our compelling story better so that the public has a sense of what community health centers are all about. And I think we're hearing today about what is that narrative and how can we communicate that story. And I think we're getting better at that. I think a second thing is we've got to do better research, and I think we're very much on to that. And so we're hearing a lot about how to do that, how to do it effectively so that we can make our case. And so I think in many ways, this is a breakout conference for us. It's international. We're hearing a lot of good information from our friends south of the border, who are really giving us some clues about how to make your case. And people from Western Europe who are here as well, in Australia. So they've all been struggling with the same kind of questions that we're struggling with. But I think there's a level of sophistication now that is coming, and infusing and informing and inspiring the kind of communications work that we have to do.
So you talk about two things, sort of data and drama, the sort of narrative and the evidence, right? Is it, from what you're seeing from other countries, what you're hearing today at the conference so far, is it a blend of those things, or is one thing winning over the other in terms of being persuasive?
I think fundamentally it's a blend of both. And I think you've got certainly some folks who are very much focused on the research side. The researchers, obviously the academics. But if we don't kind of speak to the kind of passion and the heart and soul of what our movement is all about, we won't capture the public imagination. When you talk to people, I work in a community health center, at the Somerset West Community Health Center in downtown Ottawa. People on the street get it who come through our doors. They understand. You got to make the story real. You got to personalize it, and so you really engage people, and people understand. And that's the kind of beauty of kind of working in neighborhoods and working in communities, to really talk about the kind of things we can do, not just helping individuals who come through our door, but what can we do to build a healthy community.
Are you worried in Ontario or federally with what's happening politically in terms of community health centers?
Federally, I think it's a tough time, because I think we have a federal government who really doesn't care very much about any kind of national network of CHCs. I think they simply want to leave health system planning, health policy to the provinces to do what they think is best. So I don't think there's much traction there for any kind of meaningful discussion about national health policy.
Which is tragic, right? Because that was meant to be the second stage of the Medicare system, right?
But I think where there may be a bit of optimism with the new official opposition in Ottawa, the party of Tommy Douglas, I think they will be vigilant in speaking to such issues as the second stage of Medicare. So that's where I'm a little more optimistic than I have been. So maybe that's encouraging. Provincially, I think this particular government, the McGuinty government, has been sympathetic and certainly has seen the expansion of CHCs in the two mandates of that government. So moving into an election, it's always going to be a challenging time if there's changes with a new administration or whether they're re-elected. I mean, I think we're making tremendous headway. I think increasingly senior bureaucrats in the Ministry of Health, CEOs of the local health integration networks, as well as many provincial politicians, are understanding that you have to invest in communities, or you're going to so swamp the system with the cost to the acute care sector and the hospitals that we're going to have not much money left for much else. So people are starting to get that message. You've got to invest in communities. And that's a message that we've heard loud and clear from the folks south of the border, and they very clearly demonstrated with some amazing data that because where there are CHCs, there's less visits to emergency rooms. Where there are CHCs, there's less hospitalizations. That's the kind of data, that's the kind of information that people have got to be listening to really, really closely, and then making good decisions about it.
Good. Thanks for joining us.
Okay, it's a pleasure.